we go. How many people here are PharmDs? Are there any pharmacists? No. How about from academia?
We can't see you, so just call out yes. Like, we cannot see a single thing up here.
How about biopharma? Did we do that one?
Yeah. Okay, ooh, I like that.
Awesome. Healthcare providers. And fellow nonprofits. Okay. So I'm going to go over our itinerary for today. First, we're going to go over our individual backgrounds, then how the collaboration began. Then I'll talk about the Healthcare Navigation Project's program, and Danielle will talk about Columbia's program, and then we'll end with our collaboration, and then any questions and answers. Questions that you have, we will answer, hopefully. So you already know my name. It's Lauren Kopsick, and I'm the founder and executive director of the Healthcare Navigation Project. My story is I hold a sociology degree in juvenile justice. I then ran an outbound call center. I've been a mortgage banker with Chase with what would be $800,000 in secured lending authority. I've been in corporate marketing, training, and development. I'm a small business consultant, and I co-founded an adult pediatric support group for the Crohn's Foundation in Richmond, Virginia. But I'm the most proud to say I'm the mom to two now man boys, I'd say. My older one is neurodivergent, so I started with the education system, learning about IEPs, occupational therapists, physical therapists, speech and language. Then my younger son was diagnosed when he turned 11 with, since we're in with company here, fistulating Crohn's disease, and then subsequently something called hidradenitis suppurativa, which I dare you to say 3 times fast. And so by 2015, I realized that there is no way that my children would ever be able to navigate this. I had already become a SME, or whatever you want to call it by then, and I was having trouble. So I realized that nobody was going to be able to do this, but I did. So, and I didn't know about all of you guys then. So I spent about 7 years researching, and in April of 2022, the Healthcare Navigation Project became a 501c3. We were copywritten, and now have a patent pending on our method and systems. And with that, I'm going to turn it over to Danielle.
Hi, everyone. Oh, I can see you if I do this. So it's weird for me not to see people, but hi, I'm Danielle Rome-Martin. I'm a clinically trained art therapist and occupational therapist. And honestly, this experience last year when Melissa invited me out to this organization was profoundly life-changing for me as an occupational therapist who's been treating patients primarily in their home care. I sat in this conference last year and started naming off the patients that I failed. I didn't know enough to help them. And so one of the great things that I have now as a professor, adjunct professor at Columbia University, is I get to come back and learn how to help people via my students. So I've been treating clinically for about 18 years. I spent 4 years as a clinical evaluator for clinical research trials at Columbia University. And this is a really exciting collaboration we're going to get to speak about because it came directly from networking at last year's conference. I missed Lauren's presentation, and at SwapCard, who has it, use it, I reached out and I was able to connect with her, and we were able to form a really exciting thing we're going to share with you today. So thank you.
I think we should go back to the first one, the 4 million. We missed that one.
There you go.
Okay. Did you know that 4 million children turned 18 in 2022, but 3.4 million of those now adults have no idea how to navigate their health or care? The Healthcare Navigation Project at its core is about education and empowerment, giving everyone the skills they need to manage their own health and care. Learning before instead of after when it's already too late. A program that's always customized to the participants, never one size fits all. We don't use workbooks because, like I said earlier, I know that people learn differently, and we know this. So we really don't do slides either, but for today we have them. Instead, we do everything together in a live or virtual environment, and we end with phone calls to trusted resources, taking away fear and replacing it with empowerment. You can go. We know that 9 out of 10 people have limited health literacy, and low health literacy is linked to, of course, the increased emergency room visits, longer hospital stays, not following their treatment plans, and higher mortality rates. That is why our program, the HealthCare Navigation Project, focuses on social determinants of health, Healthy People 2030, and the CDC's new definition of what health literacy is, which as of 2020 includes an additional word called use, which I found really interesting because what's the point of having health insurance if you're not supposed to know how to use it, right? So the new definition is the ability to find, understand, and actually use your health care, and to be able to use it well enough to make a well-informed decision for not only yourself, but other people that you might be in charge of, right? And then finally, if everyone has those skills, I mean everyone around the world, that's when you can say we have health equity. The other part of our program that we follow is the World Health Organization and what they believe that, or what is the 3 main categories of life skills needed for global positive mental health. And that is thinking, communicating, and coping. So in order to achieve all of what I just talked about, we actually combine the 3 main classifications, I lost that word, of health literacy, which are functional health literacy, functional health literacy, which is the ability to obtain, process, and understand basic health information, right? Interactive health literacy is the ability to actively participate in your health decisions. And then we have critical health literacy, which is what we all have, the ability to analyze and self-advocate, which of course, again, leads to empowerment. We also focus on behavioral change as an intervention, and the only homework you have is to share forward with at least one other person what you've learned, breaking down the barriers that will interfere with health usage. And we scale through what we talked about earlier, collaborations. We also have an ambassador program and train the trainer. As an aside, I probably should talk about buy-in. It's incredible when you do this program to see people open up in all kinds of ways that you never even thought was possible. And that's when I believe we can truly make a change for the better. When people can tell us what they need rather than us telling them what they need. And then finally, I'm going to give you an examples of some of the modules that we can create, because again, they're customized. So with basic healthcare navigation, that's for anybody from transitioning as a new parent, as pediatric to adult, adult to super adult, and then just anybody in between. The mental health toolbox, I don't know if anybody in here, you didn't see it because you missed it.
I missed
but
it.
I did this module last year, the mental health toolbox, and that follows along, like I said, the World Health Organization and the 3 categories of life skills. We learn about communication, And then this is one of my favorite modules. For the pharmacists, I don't know if anybody said they were pharmacists out there, but we dedicate this to all the pharmacists in the world. We love pharmacists. And specialty healthcare, I think we missed that one. Right. That's where we learn how to research, which is, as you guys know, a little differently than what you would think. And we learn about nonprofits and all kinds of other things. And then finally, what I call healthcare financial literacy, and then hospital navigation and the future. And now I'm going to give it back to Danielle.
I'm having too much fun with the clicker up here. I'm sorry. They told me there's a back button and a movement, and I just keep pressing it. So I'm excited to be here because last year I think I was one of the only occupational therapists here. Is there another occupational therapist in the room? No. Anyone ever been to occupational therapy? Call it out? No? Wait, I see a hand. Love it.
Oh, there's a couple. Wait, there's a couple more hands up.
OT? You're an OT? I'll heart you. So I think you know what I'm about to say is a lot of people will see occupational therapists or understand occupational therapists, and you likely will only know the one track that you interacted with us, but not fully understand our entire scope of our profession. So I'm getting this great opportunity to do that, and she'll call me out if I said it wrong or if I agreed. But occupational therapy is a holistic and client-centered healthcare profession. We focus on enabling individuals to participate in meaningful activities. Your life. We participate in every aspect of your life and how you choose to live your life. So whether it's maybe you had a physical injury or a mental health challenge, developmental disorders, or just transitions unto itself, occupational therapists can come in and assist so that you have a satisfied and a very, very full life. But one of our most important aims in occupational therapy is to empower individuals to live as fully and independently as possible by promoting your health, your well-being, and your quality of life. And that's the key word for here, empowerment. We empower patients by developing the skills and strategies that they need. So we're focusing on how to enhance people's abilities, their self-confidence, and their sense of autonomy. We do this through personalized interventions or group interventions and how we might break down the barriers that you have. And they could be any type of barrier, policy barrier, environmental barrier, home barrier. We work with every part of it. But by advocating, we contribute to a more equitable healthcare system. I have to stand up now because I'm afraid she might hear what I have to say. But I believe that, and I'll be the first to say it, we are missing a part of OT. We are missing a part, and it's on us that we're not advocating enough in our profession for our patients. And that's why I'm really excited to be here, because there's so many things with healthcare providers that we function and we assume that our clients actually know how to use their healthcare. We assume they have the resources sometimes, and we assume they know how to navigate it. I don't know how to navigate my healthcare. Anybody else? Right? I don't always have the resources. But we kind of get into this motion where we're having productivity rates and we're having burnout and we're having EMR systems that we forget that our clients and our patients need all those resources and they need us to help advocate for them. We, as many healthcare providers, are in a burnout cycle that's happening right now. And so I don't really believe that we are fully equipped in our profession yet, or we've lost our way a bit to continue to advocate for our patients appropriately. And that's why I'm really excited about this collaboration that I'm gonna get to tell you about. So one thing is really important though, we as OTs, we are all about health literacy, but we do it in a few different ways. So we do it in specific communications, how we tailor our communication to our client. I'm an actress in so many different homes because I need to tailor how I'm gonna speak, how I'm gonna act, how I'm gonna do it based on my client's needs, on maybe their health literacy level, maybe on their language barriers, their cognitive barriers. It changes minute by minute. The other ways we do communication is we're building skills, we're empowering through participation, and we're looking at cultural sensitivity, but not all the parts that we think about with diversity. We're talking about health beliefs. How many people here have interacted with people who know they have a different health belief than maybe yourself? Right? We have to be very sensitive to that. especially when we're coming into someone's journey, their journey, that we're walking along with them. We have to understand the different health beliefs that they have. Of course, we're looking at uses of technology. I think everyone knows we range where you have the person with the business card and the appointment, or someone who's very savvy that can do the portal. And this changes amongst all of our clients. But more importantly is ongoing support. The most important thing that we do as occupational therapists is not actually in the interactions that we see you with. It's when we leave you and you are having this therapeutic use of self. You are going through an extension of therapy care. And this is where I think advocating in our field needs to continue and be built up a bit more. So by implementing these strategies, we can improve a client's health literacy, leading to better health outcomes. And the HealthCare Advocacy Project, Lauren here and what she has developed, I believe, is the missing piece that I see in my profession right now. It's the missing piece that we need for training our future therapists. I want to kind of fast forward after Lauren and I met at this conference last year to 6 months later. We started to have a very collaboration between myself, Lauren, and Dr. Rochelle Mandanka, who's not here right now. She's the doctoral director of occupational therapy at Columbia University, and Dr. Tyra Banks, who's the diversity and equity officer for the OT program at Columbia University. So we kind of started working on a really intimate collaboration. It was like a close dynamic partnership, which is the best kind that comes out of networking, honestly, where we started to deeply engage with one another, blending our unique perspectives, our ideas, creating trust, creating creativity and mutual respect. And with that synergy, this amazing thing became created, and it's called the Health Project. And I'm really excited to give you the details, but I know you guys are too, I think, right? Okay, I love it. All right, I'm going to give you the details in a second. I can't see anyone.
I know, it's hard to talk to an audience that you can't see.
I feel like it's back in Zoom when none of my students would turn their cameras on at all. So one of the pillars of our collaboration and our project was enveloping all of the Healthcare Navigation Project's ways that they're using health literacy, and we were able to coin the new phrase called transitional health literacy, which is the interaction of the functional, oh yeah, I forgot the slide, fun. Sorry.
There we go.
Thanks. Which is the interaction of functional, interaction, and critical health literacy. Now this phrase didn't just emerge as a combination of words. It really was a reflection of our insights, our values, and our aspirations within our collaboration. So that sounds exciting. Transitional health literacy, right? Students, right? But I really want to have you understand that the Health Project doesn't just address health literacy. We're really trying to blend what the Healthcare Navigation Project does so well in their Train the Trainer program and the Ambassador program, along with the OT professional standards that we have. And we're trying to solve the bigger problem in our healthcare system, which I believe resides with the healthcare providers. I really want to point out this study because this is an alarming number. 76% of healthcare providers surveyed experienced challenges due to low health literacy of patients. 76%. That's astronomical in my opinion, because I always think about that and say 76% of patients did not get the right treatment. 76% of patients did not fully understand their medical experience. And so some will say, well, let's provide health literacy programs for patients, or let's provide health literacy programs for providers. And honestly, our solution was let's do both. So we're going to continue to grow the successes of the Healthcare Navigation Project while we're increasing empowerment and health literacy among people, but we're adding another layer. We're putting the onus and ownership of that on future healthcare providers, and we're going to do it bi-directionally. So OT, we're constantly teaching back, right? I don't know, she may have left. But we're constantly teaching back. You know, if I'm going to show you on hip precautions how to open your fridge and pull out that milk, I want to see you do it. So the same kind of concept that we're going to bring to this program. We're going to be teaching back. But here's the thing. We're going to make sure that future healthcare providers are not just empowering their patients and having them teach it back. We're making sure that they're teaching this back to their future selves, the future version of themselves that might be 5 years down the road in the trenches at the local underfunded hospital with a high productivity rate and burnout right around the corner. Because they became part of our program, they're going to remember that advocacy will always be the main pillar of what they need to stand for. So the Health Project aims to address health equity by tackling disparities in healthcare literacy, access by using module-based empowerment to achieve its goals. The Health Project aims to close the gap in healthcare coverage and understanding by educating and training individuals and creating a future occupational therapy workforce equipped to address healthcare literacy disparities, to continue to empower people to be agents of change in their community. Now, the Health Project will empower occupational therapy students. Not to say that us providers are a lost cause, but we are aiming at students right now. So the students will learn they will learn the program, the module program by the HealthCare Navigation Project. They will learn to be educated in it. They will learn to disseminate it. These specific modules, so we're recruiting the students from Columbia University, and they're going to receive tailored training to deliver customized healthcare navigation modules. Each student will then train a cohort of community members, equipping them to become ambassadors in the health program. So the students are working with the community is becoming ambassadors in their program, and the students are being ingrained, embedded with that muscle memory of what advocacy really means before they're engaged in healthcare burnout. So where will this community of change take place? We'll be working in a historically marginalized community, Washington Heights, New York, which does have a comparatively high rate of ER usage for typical doctor visits. It has a very high rate of maternal fetal health at risk compared to the rest of New York City, and this area self-proclaims mental health as its #1 health priority. So this is where we're going to be empowering. This is where we're going to make that community of change agents. The American Occupational Therapy Association is my professional governing body, and what we're doing here is we're specifically working with the AOTA standards to lay out every aspect of the health project and every aspect that we're doing integrating to educating students, future healthcare providers, so that this doesn't end up being just a freestanding collaboration. We're trying to ensure that this project is our proof of concept that we can indeed change an entire profession across standards and core values that are going to propel us for a new vision of healthcare providers. And myself, and along with, I think, our team, and along with Dr. Tyra Banks and Dr. Rochelle Mendoza, we firmly believe that change starts as students. Students that are just beginning their clinical rotations, who are developing a mindset prior to the big bads of healthcare that we all know. And as Lauren said in the very beginning of this talk, we are acting before and not after when it's too late. That is our program. And I think we have 3 minutes, if anyone has any questions on our collaboration. Well,
No question.
no questions, but thank you so much for your time.